Hi, I'm Dr. Divina Lopez, a board-certified pediatrician with over 10 years of experience in pediatrics, and you are listening to Dancing into Parenthood. Hi, I'm Dr. Divina Lopez, a board-certified pediatrician in the New York and New Jersey area. And today we're speaking with Dr. Ardon, who is my friend from medical school. She is a psychiatrist. She was born in Guatemala City and is a graduate of Marymount College, a women's college in Tarrytown, New York. She obtained her medical degree from Ross University School of Medicine in Dominica. Her residencies were at Cabrini Medical Center, an affiliate of Mount Sinai in New York City, and Westchester Medical Center in Valhalla, New York. Dr. Ardon completed her training with a fellowship in child and adolescent psychiatry at Yale Medical School at the Child Study Center in New Haven, Connecticut. She has 10 years of experience working with adults, adolescents, and children in all areas of mental health, ranging from mood disorder, psychosis, ADHD, anxiety, to substance abuse. She has served as a medical director for New Milford Hospital in New Milford, Connecticut, and as an attending psychiatrist at Danbury Hospital and Family and Children's Aid, both in Danbury, Connecticut. She served as an attending psychiatrist in Scottsbluff, Nebraska. She also was an attending at St. Mary's Hospital in Waterbury, Connecticut, and she currently has a private practice in Connecticut as well. She is fluent in English and Spanish, and she resides in New Fairfield, Connecticut. She is a mother of two, not little boys. She has a big guy and she has a little guy, and today we're going to be discussing postpartum depression. Welcome, Aura.
Thank you, Divina. I'm glad to be here and going through this topic, which is very important for every woman and their families.
I think we have all, as mothers, have gone through transitions in motherhood, and this is such an important topic for us to speak about, because I think even myself, I've really had a little bit of a challenge with some postpartum depression, or maybe even just baby blues, but I didn't even realize it until much later. I mean, really years later after having my son. Maybe because I was a medical professional and I was in denial in some sort of way, or maybe also because my personality is just to kind of take everything on and keep pushing through no matter what I'm going through. And I'm also a person who doesn't share things that easily. I'm one of those women that thinks that I can handle it all on my own. So I think I struggled through that period of time, and I'm sure that many moms, especially new moms, go through this themselves.
Yeah, I think a lot of women don't want to discuss a lot of the feelings they have after giving birth or even before, because there is not only baby blues, but now we also know that there is a period that we call peripartum depression, which women start having depression when they are pregnant, and it can continue after they deliver. And if that happens, they usually have to get treatment, either individual therapy or talk therapy or medications. Because if that continues during pregnancy, women have a risk of low weight, babies having low weight, or abortions or premature deliveries, which later on in the future affects the baby also.
Okay.
And then when we talk about baby blues, I think it's probably between 70 and 80% of women that go through pregnancy and delivering a baby have baby blues. The difference between baby blues, depression, or even psychosis is that baby blues is only lasts a couple of weeks, and it's not as severe as going into depression, because after 2 weeks women usually go back to their normal being, enjoying what they're doing on a daily basis, enjoying being a mother. They don't feel guilty for feeling overwhelmed. But if those symptoms get worse and is after 2 weeks, then that is no longer baby blues. It becomes more as a depression at this point. And at that point, we call it, yes, we call it postpartum depression, but basically it's major depression disorder with postpartum.
And can you talk about what are some of the signs of postpartum depression?
If the symptoms of feeling sad continues after 2 weeks, some of the symptoms are feeling hopeless, helpless, difficulty sleeping, although difficulty sleeping is also contributing because a lot of times babies are waking up every couple of hours for feeding. That also doesn't help. But when we talk about difficulty sleeping, is that even when the baby is sleeping, the mother is not able to sleep during the day. That can cause those problems. Crying for no reasons, feeling very anxious, either in general for everything or anxious about the baby. At times they also get angry and irritable, and a lot of times they don't understand why they feel angry and upset.
Right.
But also they have these feelings of guilty.
Right.
Why do I feel this way?
Right.
I should be happy. I have a new baby.
Right.
And then that whole cycle gets them into getting more depressed. And it's a combination of a lot of different things.
Right. Also, you know, I totally understand that whole like guilty part of it, because you want to enjoy that period of time with your newborn and you feel like you're not taking advantage of having that joy in your life, and then that almost like backfires on you. But what or who is at risk for getting postpartum depression?
I think every woman, at least 10 to 15% of the general population are at risk of postpartum depression. Women that are at increased risk of postpartum depression are women that had already some type of mental health issues before, or even during their pregnancy. Also women that have family history of mental illness, either depression, anxiety, bipolar disorder, then women are at risk of postpartum depression.
Okay. So are those women usually screened a little more like during their prenatal period by the OBGYN, or is it usually like a therapist or a psychiatrist who's also seeing them at that time?
No, now I believe starting in 2010 there is a recommendation that every pregnant woman gets screened for peripartum depression and postpartum depression and psychosis, because of the high incidence of baby blues and then continue into depression. That now we want to make sure that women get the right treatment. And also it is important for women to be very open and not feel ashamed that they are feeling down, because for a lot of women, even myself, we think well, this should be a time in our lives that we should be happy, but that makes them feel ashamed. Why I'm not feeling happy or energetic?
Right. Well, it's really overwhelming. A lot of things are going on hormonally in your body, and you're adjusting to that, and then having a new person to care for on top of all the responsibilities that you already have can be really challenging. So I always feel like the sleep deprivation just adds to it, and even though you're trying to like handle everything, those sort of feelings of like feeling overwhelmed and guilty, and maybe if you don't have the support that you need, that just makes things really challenging for the mothers. And a lot of times they are so afraid to even talk about it because they see things on social media of like women handling it all, looking so perfect, you know, the weight comes off with some of the other women and they're taking these fabulous pictures and they look so happy with their newborns. And sometimes I think like social media can even add to it in a way, because we want to have these beautiful looking lives, and unfortunately that's not the reality of it. Like, for example, when we saw you know, the prince and the princess just recently, you know, they had their baby and they came out of the hospital looking picture perfect like models. I mean, that's just not the reality of what having a baby and coming out of the hospital looks like. You know, usually it's really messy. You know, you're lucky if you have your hair pulled back in a neat ponytail. You just, you know, the reality is that it's overwhelming, that you want to take care of yourself in the same way, but you don't have the time to do it, and then your time is shifted over to the baby and you're just like figuring it out. So I think it's normal for women to accept that the first few weeks are going to be really kind of messy, and that's normal, because I feel like there's so much pressure these days for things to look so good, when that's just not the reality.
Imperfect.
Yeah.
And the thing is, that is not only the look outside, but internally the woman is going through a lot of changes hormonally.
Right.
And that is also why the high percentage of women, between 70 and 80%, have the baby blues, because our hormones are really up and down.
Yeah.
The thyroid, which is very important in our mood also, sometimes is not stable yet. And those are things that when they get a screen, it is important for their care providers to check for thyroid.
Right, to rule that out.
Yes, to rule out any endocrinological problems that may contribute into the symptoms of depression.
Right. Okay, so how is postpartum depression treated?
There are a few treatments, and it can be either individual or a combination of things. Sometimes it's only individual therapy, going to talk therapy, that will help women to kind of make some changes at home, and also their partners or and families to help them. So they will bring the family into the treatment to help them around.
Okay.
And then it is also medications. Usually the antidepressant medications are the first line of choice that we use for postpartum depression. And but very important is to have support.
Right.
And the family being on board.
A part of the treatment.
Yes. And sometimes a combination of both therapy or talk therapy and medication is the best type of treatment for some women.
Right.
And then we also talk to the family too, and also help women to be able to be more open with their families and ask for help. Because as women, sometimes we think that we can handle everything and anything, and we don't want to ask for help.
Yeah.
Or a lot of times also culturally.
Yes.
Culturally, we feel, well, the woman is the one that needs to get up in the middle of the night and feed the baby and do everything. So we all get sleep deprivation because of that, when it's a whole family treatment.
Yeah, because just like they say, it takes a village to raise a child, and I really believe that. I think, you know, that's part of the reason why I wanted to even start these podcasts, was because I felt like so women individually were going through these things and not talking about it. And, you know, just sharing your stories, you know, can really console another woman and understand, like, okay, this is just part of the process. How can I reach out to others? What did they do? How do I get more support in helping me go through this transition in life, so that you can overcome it in a really good way, and getting that support that you need from family, from friends. And maybe it's not even from your own family and friends, but maybe you can find it in another community of mothers who understand what you're going through. And, you know, sometimes just knowing that makes you feel a lot better, helps that guilt go away, or that anxiety, because, you know, being a mom is just so much to take on all at once. There's so many changes going on at once as a new mother, especially. And so as you're figuring it out, understanding that other women feel the same way is really comforting. So that was part of the reason why I wanted to start these podcasts, to have a community of women together so that we can honestly speak about what motherhood is. It can be thrilling and wonderful, and it's a gift and it's a blessing, but at the same time there's a lot of the, I don't want to say crippling parts, but there's a lot of times when you feel a little isolated, and it's because you feel that guilt or the anxiety about what is actually going on, about your life no longer just being focused on you or your partner. It's like you, your partner, and now the new family that you're creating.
I'm glad that you're doing this, because mental health, a lot of times we don't get to talk about it. And even when the screening techniques are given to patients in the primary care, a lot of times women feel uncomfortable being open. And I think being open and honest, and don't see mental health or feeling depressed as a stigma is very important. And because it is very it is something that is treatable. It's very easy to treat. And if it doesn't get treated, then we have more problems. For example, if postpartum depression doesn't get treated, sometimes women start having suicidal thoughts. Unfortunately, sometimes there have been cases where mothers have killed their babies, and it's because their symptoms are getting worse. And then sometimes we also need to take into consideration psychosis. And a lot of times we talk about postpartum depression, but we leave out postpartum psychosis, which postpartum psychosis also can happen even the first day after giving birth, up to 1 year. And that is a little bit different than just depression. Women start being more disorganized. They get paranoid, think that somebody's going to come to their homes and do something to them. Their families start noticing, well, something is not right here. And that's when a lot of times women go and see a psychiatrist, is when the symptoms are really bad or worse, that families start noticing. But when they are just depression, a lot of times the family don't notice that, and women don't talk about it. And so it is important. I'm glad that you're doing this, so we can get women to get the help they need. And there are a lot of different things, not only medication or therapy, but involving the family, like I said, in knowing the signs of what is depression, what is baby blues. So again, baby blues only lasts 2 weeks. After that, women bounce right back to their normal life, kind of enjoying things. If it's beyond 2 weeks, then it's something that needs to be considered and taken into consideration, seeing a primary doctor, either their OBGYN, and then their OBGYN can refer them to a therapist or a psychiatrist, or both. I think for families, it is important for the families to listen to the mother, and to pay attention to them, and to give a lot of support. Kind of sharing the responsibilities in the house, and also what do women can do. For example, at night, if the baby is not a good sleeper, but if they sleep during the day, women should try to take naps during the day to help them. Sleeping is like a vitamin. It's
like a form of medicine, really. It's important. One of the things that you mentioned was like the screening, and how women sometimes are afraid to be honest about those screenings, because as a pediatrician, we also screen postpartum. And I feel a lot of times the moms are just like brushing off those questions, and everything is fine, and I always try to check up on them. But definitely I agree with the cultural, like being Latinas, we are almost, we are trained to take care of everything at home, and even with our partners, and you're almost sometimes made to feel a little guilty if you can't do all of those things, because it's like your mom did it, your grandmother did it, and so why can't you handle that? And that's one of the things that I wish we could actually change in the culture, because a lot of my patients are Latinas, and I feel like they feel this pressure all the time. Or even if they do try to discuss it with their mothers or their aunts, it's almost as if it is kind of like, oh, don't be lazy, like this is what you need to do, because you need to handle it all. And then you feel worse in that way, because sometimes you are trying to reach out, but you're not getting the support that you needed from them. So I do think it's important to have really good communication with your partner. Maybe if you're listening to this before the baby comes, come up with a plan, because once that baby's here, sometimes it's a little hard to do it. But come up with a plan of how you're going to tackle that transition when the baby's not sleeping at nighttime and feedings have to be done, especially if you're breastfeeding, because at night it is easier to just put the baby to the breast instead of pumping or, giving the bottle. And if your partner is working at that time, you want to allow them to have the rest that they need as well. But I think coming up with some sort of plan for everyone to get a little bit of rest is important, and knowing that your partner is supportive during this time period is super important. I wish that people had really good, honest conversations about that before the baby comes, so that maybe it would make that transition period a little easier for the mothers.
But also having that conversation also opens the doors to family members or the partner to be aware of what the symptoms are, so that way they can recognize it and say, well, let's go and get help. Because encouraging the woman to get help is very important, because sometimes, like we said, as Latinas, we want to do everything and we don't want to ask for help. And encouraging the family to, I think as women, we also have to make sure that we ask for help. And like you said, before the baby comes, maybe tell the partner, if I feel this way, if you notice this, can you please help me? Ask for help. There is no shame for asking for help. We teach our kids. When you go to school, if you don't know something, please ask the teacher. And then we don't do it.
We don't do it for ourselves. That happens too often. Yes, I agree with you. Well, Aura, is there anything else that you would like to share?
Well, I think it is important for anybody listening to this, that if they are feeling suicidal or they feel hopeless and helpless, that there is help for them. And there is a national suicide prevention line that they can call. Is 1-800-273-8255, and it's free and confidential. And they can call, usually also the towns where they live, they can call 911 and they can refer them to a crisis intervention. But there is a lot of help. And when you said if there is anything, when I went to medical school, I wanted to be an OBGYN initially, and then
so did I.
And then when I started doing my rotations, I went and I did psychiatry, and the patient that I honestly remember that made me feel like psychiatry was the field I wanted to go was a patient that I saw in an inpatient unit with postpartum psychosis.
Oh, wow.
And then after a week of treatment, the patient was, unquote, normal. And I was so amazed to see how we can go from one stage of behaving and being to another in such a short period of time. So there is help. The medications help. So please reach out and look for help.
Okay. Well, I'm going to wrap it up here. Thank you so much, Aura, for joining me and being so gracious to do this podcast with me. I know how many mothers are going to benefit from this, and this is such an important topic. I am happy that we were able to discuss it today. But again, thank you so much for joining me on this podcast. And if anyone would like to have more information from Dr. Aura Ardon, I will be more than happy to connect you with her. Have a great day, everybody.
Bye-bye.
To listen to more podcasts, please visit us at drdivinalopez.com and follow us on Instagram at Dr. Divina Lopez. Thank you for listening. Please keep in mind that all advice given in this podcast is general information. To understand your specific situation, you must consult with your pediatrician.